The queen had only one way of settling all difficulties, great or small. Off with his head, she said, without even looking round. The darkness within the borderline queen is emptiness. Her inner experience is deprivation, and her behavior evokes compliance. She is demanding and flamboyant and may intimidate others. The queen feels entitled to exploit others and can be vindictive and greedy. The queen's emotional message to her children is, life is all about me. Hi, I am Dr. Kim Sage. I'm a licensed clinical psychologist, and I'm so glad you're here. I want to go through, I've been kind of going over and over again, why I'm here and what I want to really help people understand. And I really want to talk today about the dynamic of the borderline mother in the presentation that has historically been called initially by this book, the Queen. And I'd like to go into other videos with more in depth on each of the styles. And so if you want me to do that, please let me know. I think that it is really important because, for example, disorders like BPD are so complex, and they're complex for the individual who suffers, and they're very complex for the child. And the heart of really why I am here is because I think for so many of us, regardless of whatever the reasoning is, it wasn't always bad. Yes, in many cases, there are families where there's just nothing good. But where I think it is the hardest to process and understand is with someone who has some layer of trauma, genetics, that manifest in things like borderline or borderline with narcissism in some way, where, like I've always said, you get some kind of what I call good love. And so the problem is when they are in the hurtful places, it is incredibly toxic and damaging. And it's not just, oh, my mom had a bad season or was struggling. It is a pattern that I believe is the profound heart of our trauma and how difficult it can be to unpack. So I want to start with, as I've said, this book. This is the book that I read that honestly, after all of the education and really, to be honest, demonizing of borderline so much even in the treatment community, that we only talked about extremely clinical populations and, oh, you would know a borderline when you saw them, and that is just not true. It doesn't help them. It doesn't help us. And so I want to start with the Queen presentation. I'd like to go into the other ones. In my course on this issue about borderline mothers and narcissistic mothers, I go into all of the types, and I think I would like to go into depth to each one and talk about not just the style, the impact. Remember that no person, though, is one type. It's just that if you say, oh, this kind of feels like the flavor, maybe they have other tendencies, that's important. So in this book, there are 4 types: the waif, the hermit, the queen, and the witch. And then in other different ways we've talked about borderline, we have, and I have it here, but impulsive externalizing, quiet high functioning, which I'm going to make a video on probably next week, discouraged, self-destructive, depressive internalizing, the petulant histrionic type, and another kind of grouping of borderline that's just in 3 types called the BPD, kind of like core traits. It's a subtype model of extrovert externalizing, core BPD, and schizotypal paranoid. So I'm going to try to figure out how to go into those in different ways, but I really want to start with this one. And so I just want to acknowledge that if you are someone who has borderline, that I know the language and the descriptions can be hurtful, and I don't want you to feel that way, but I think the intention was to just paint a picture, an image of what it feels like to be on the receiving end. And that is what this channel and these videos are really for. There are so many amazing, amazing channels if you have borderline. This is one that I hope if you're watching it and you have it and you're thinking about, treatment or not, or kind of struggle with your own self-reflection, or maybe you need to make repairs, whatever it is, that you can use this, or you're the partner or child really at the core, to feel understood and validated. And the reason why I think it matters is because once I knew there was, that is really what I think that she struggles with, it truly gave me permission to finally start to say, you are not a bad child, you're not a bad person, and it was never your fault, right? And so because the internalization of even still being, well, I'm the bad one, because I set these boundaries, or I went no contact, or I have a tea party relationship, whatever it is, a surface relationship. What we carry is that deep inside, because we've been so wired on the receiving end of these behaviors, is that we believe that there's something deeply flawed, that no matter what anyone says or our life looks like, deep inside, there's something about me that makes me different and unlovable and unworthy and bad. And so that is why I really want to go into it. So let's get into what the Queen presentation looks like in terms of the sort of dynamics. Remembering that the heart of borderline is emotional and relational instability, with things like identity disturbance, like changing who they are, not knowing who they are, oftentimes, very impulsive behaviors. We can see a lot of just really self-destructive behaviors at times, really difficulty managing, though, at the core, I think, what you experience. And it may be, from one extreme to the other, but it's this mood and relational and kind of mind instability, where there's these distortions of thought. There are these, moods that can swing. Very, very common to have extreme and out of control and kind of hair trigger temper and rage and frequent anger that feels uncontrollable and scary. If it's a more internalized type, it kind of plays out differently. But those are kind of the heart. We see a lot of that. And I think I'll post a card here, which is the classic criteria in case you're kind of new here and discovering this topic for the first time. So the Queen feels at the core, what this book talks about, Christine Lawson's book talks about, is that the Queen feels empty inside, but the way it manifests often is through entitlement, right? There's this attempt to feel like a queen, to finally be, filled up and seen in a way that feels powerful for them. And so it can express itself in, arrogance or entitlement. It's like, I'm up here. There's a very clear hierarchy. Let's say if this is the mother, this person rules the house, is the queen often over the other partner, kind of sits at that top. The next one is they want money, beauty, attention, loyalty. Now this is where we can see, I believe, layers of narcissism, because remember that all of these things are not just one category. We have these complex dynamics because people are complex. The next one is that they can compete with their children and be jealous of them. And this is what I would also say has a flavor of oftentimes narcissism and with the borderline. And I think what happens is when you see these things, the last two, people just decide that, oh, my mom was a narcissist. But people post a lot of my videos and say, well, but what if they were also like great and good? And I've certainly had this experience in therapy with patients who say, yeah, but she could be like so terrible, but she's also like the greatest person ever. And I have no doubt that those are both true. It's just that when you're a child and you don't know what to expect and predict, you have to develop certain defense mechanisms to survive that, right? Like fight or flight, hypervigilance, to freezing or collapsing, to shutting down, to fawning. Clearly, fawning would be a very strong response with a mother like this, or a parent, caregiver, even a father. Although I think male borderline at the core is the same, it presents differently, and sadly we are not doing a great job of diagnosing men and getting them the support and treatment they need. Also, don't forget that a lot of these things we talk about with borderline have historically come from highly clinical populations. And what does that mean? That means people who were already in a residential program for mental health. They may have had an attempt to wound themselves and they were hospitalized. So this is at the high end also. So we can have a very much like turned down flavor of these things, and it can still be diagnosis of borderline. They can act selfishly and domineering. And so you're really going to feel that it's their way or the highway. They're in control. Like I said, that's the presentation here. If others push back, then they're the enemy. And so if you are giving feedback, then you're attacking them. If you are saying, well, you said this to me, and they don't remember that, which they often don't. I think they really often have a really strong dissociation when they're in anger and rage, which many of us can. And they will say to you, I didn't say that. I would never say that. And sometimes I think they know that, but oftentimes I think that they really just don't think they're capable of that, or that they would say that, or they don't remember it. And so that feels like you're lying to them. So they will push back, and then you become the enemy. And that splitting we talk about, which is like seeing everything in all good or all bad terms, which is what they do. They basically put that onto you. And so you feel that you're the all good or all bad child. They have a hard time holding those dark, bad feelings, so they want to kind of offload them and get them onto someone else. They often expect their kids to see the world the same way they do. And so these are parents that would not do well with you having a different religious or political belief, right? It's like, why would you think that? That's crazy and not okay. We see a lot of dramatic behavior here, a lot of histrionic, which is like a need for really attention, and it could be through, excessive or flashy language or clothing. I do think we can see, if you think about kind of the way you, the characteristics of the classic Real Housewife on any of the franchises, I think that the histrionic part is very common. And whether they're in the entertainment field or obviously they're trying to get attention, because if you don't create drama, you don't stay on those shows. But my point is that it's like that it's very clear through the behavior that they want attention. They can exaggerate and be very, like if it was a little thing, they'll make it a huge thing. And they oftentimes, this is true really, I think for most personality disorders, have a very poor sense of boundaries and sort of what they might say to you, what they might, borrow from your clothes or expect you to do or not do, or maybe bad boundaries oftentimes and expecting you to rotate around them emotionally and take care of them. But in this presentation with the queen dynamic, it is very much a hierarchy. They are very much at the top. And so the problem for children here is that mommy or caregiver or parent is the queen. There is no real, I really see you, I can really mirror with you. And then what happens is, because of their need for attention and need for entitlement and need to be kind of powerful at the top, it definitely creates a situation for children where they have to engage in, for example, fight or flight, right? I have to be scanning for when the queen is going to be upset with her subjects or need something. And also behaviors like fawning and, kind of like trying to always just like please and care and compulsive caretake to keep the queen happy. And so you might struggle with those qualities. And then certainly things like flight, where you just kept yourself busy to get away from her. You remove yourself a lot. That's kind of your thing. It's kind of, the way you learn to cope was to get out of there psychologically or emotionally or physically. And lastly, obviously things like freezing, where maybe you collapse and shut down when she was really angry, because certainly the queen is definitely capable of expressing that rage and anger at her displeasure. And so the other thing is that does for you is it makes oftentimes what I call self-advocacy or dealing with conflict really scary and terrifying, because in your childhood there was a hierarchy and you were never going to sit at the top of it. And oftentimes no one else in the house did either. These are the kind of parents, like I'm saying, who really do the world in the home, the temperature, the entire environment revolves around them. And so if this is you, when your childhood, you want to look at, are you still engaging in these same roles today? Is this person still the queen of the family and the torch hasn't been passed on to you, and so you sacrifice things you want or need for your children? Do they get overly involved in trying to be grandparents and tell you what to do and not honor boundaries around that? Do you have compulsive caretaking or fawning behaviors, and how do those play out? And so that would really be the core of your work, is trying to understand how this dynamic really played out in your childhood and how you might still be. Maybe you've chosen a partner who has a lot of queen behavior, and whoever they are. Or maybe you've taken on some of these traits and it's something that you feel like the only way to be safe in your home is to kind of hold that queen role because that's all you knew. And now you're like, oh, that doesn't really feel so good. I don't like what that looks like. And certainly, which I think is just a huge issue for any kind of complex trauma, is us living in that chronic hypervigilant state where we're trying to just always manage that in chaos inside of not getting in trouble, not being the bad child, not being wrong. I think it's incredibly important, and you would definitely feel that a lot if this was your dynamic. I was thinking the other night how I just still, when I get really anxious and really like, it's just like out of nowhere, I was trying like, where does that feeling track? And where I feel it the most is when I think about my mom and her being upset with me. And then that can transfer to other situations where I think someone's mad at me. But it's this like very terrified, sickening feeling not even just necessarily of their rage, but just of displeasing them because it's so intense. The pendulum swings. You're in the light, you're in the dark. And, you know, no child wants to be in the dark for many reasons, right? And so in many cases and scenarios. So that is what I think the Queen looks like. I'm going to probably talk next about the discouraged type, and also I'd like to get into the petulant histrionic type, and then we'll go into the other types if that seems like something that is helpful for you to understand more about kind of what it looks like and the impact upon you. So thank you so much for being here. If you're new, I would love for you to join this little growing community and follow along and share your thoughts and whatever you feel comfortable sharing. And also, if you are new or we want to exit the video now because you know the drill, but please check out my courses down below on the links. This is the one specifically for those of you and those of us like myself raised by parents who did really struggle with some form of, difficulty with their emotions, their relationships, their mood, if they were conditional or narcissistic or really emotionally immature or even toxic. And then I have a course called Remothered, which is really about learning to heal the inner child and the inner parent. And lastly, a course that's free if you want to just say, I'm not really sure if this was not okay, what happened to me. I go through multiple types of wounding in childhood and what I believe, and most of us agree, can count as traumatic and unsafe and emotionally difficult or physically difficult or otherwise. So I hope you'll find that helpful. Thank you so much for being here. Please stay safe and well, and I'll see you soon.